64. The people who form part of the Health Services Workers Union who are embarking on strike. And David, when I went through the list, Charlie, the entire hospital staff are on strike. So let me just give you some of them. You have nutrition officers, you have oral health officers, you have disease control officers, you have health promotion officers, health information officers, you have medical physicists, you have radiographers, you have human resource, physiotherapists, health records, procurement officers, health administrators, estate managers, dietitians, sonographers, optometrists, occupational therapists, prosthetic and orthotic group. If I don't pronounce the word, please forgive me, I'm not a medical person. You have pharmacy technologists, you have pharmacy technicians, you have health services drivers, you have supply chain officers, you have public health officers of all categories, you have opticians, you have accountants of the Health Services Workers Union, you have catering unit administrative managers, secretaries, artisans, dental technicians, diet cooks, field technicians, health tutors, hospitality managers, hoteliers, hostel wardens, IT managers, housekeepers, laborers, laundry workers, lift operators, mechanical engineers, executive officers, mortuary workers, mortuary workers, electrocardiographer, that's the I think it's called the ECG technicians, the HIV coordinators, dispensing assistants, security men and watchmen. David, 64 of them.
But if you look at what is written down there, it says what?
Etc.
So there are more.
Meaning that there are actually more.
There are more. Okay.
And David, you see, at the point where HIV numbers are soaring, coordinators are also on strike.
And indeed, Ashanti region is leading.
It's leading. this is alarming. David, here are some of the outstanding. They say it's outstanding issue, meaning that it's not new. It's maybe it has been in the pipeline for a while. There are 6 of them. There are fuel allowance, accommodation allowance, uniform allowance, extra risk allowance, book and research allowance. David, security men do research.
So when I got this yesterday and I was going through it, I asked myself, so the mortuary workers, I'm going to book and research allowance here.
David, the
lift operators, I'm going to book and research allowance here.
Maybe they want to read on how to handle cops and all that. This is part of the work, David. The 6 is continuous professional development allowance, and this is very pivotal. In every profession, there need to be a scheme that will make you advance in whatever I do. But David, when you go to Ghana laws, I always say there are beautiful laws. When it comes to the implementation, that's the issue. When you go to Act 651, which is the Labour Act of 2003, it is clear, black and white, that you cannot embark on strike when you're an essential service worker. When you read the act, they've titled it Prohibition of Strike or Lockout in Respect of Essential Workers. That is Section 163 of the Act 651, which is the Labour Act of Ghana. It reads, and I quote, an employer carrying on or a worker engaged in an essential service shall not resort to a lockout or strike in connection with or in furtherance of any industrial dispute involving workers in the essential service. So it's clear. Now, which people, category of people fall under this section of the Act 651? So you go to the LI 1833, which stipulates those who are supposed to be part of this. So these are some of the people part of them. We have people from the Bank of Ghana, the Ghana Ports and Harbours Authority, the telecommunication services and all that. But what is important to this conversation is the C, where we have health and hospital services. So the LI, or the legislative instrument, that's the meaning, 1833, and also Act 651, which is the Labour Act of Ghana 2003, stipulate that health services, those who fall under the categories I listed, the security men and all that, those who ply their profession in and around the hospital, cannot embark on strike. So, David, how did you get here? The answers lies with them, and this is where I'll end with my submission.
Thank you very much, Eugene Osei, for joining us with those information, and we're live on Facebook. Please make time. Log on to LU.